Bismillahirrahmanirrahim. Welcome guys. This is Dr. Aisha Sahib. Today we will discuss about how to take a history from a pregnant woman being with complaint of jaundice. So this is the easiest most complaint I will discuss now. Ask about the details of the biodata. Then comes the presenting complaint. In the patient, with the patient and with an ops patient that came with a history of any jaundice or yellowish discoloration, following are the presenting complaints with which the patient can come. It can be either yellowish discoloration, fever, nausea, vomiting, abdominal pain, or pruritus. Inquire about the date of admission if admitted and the mode of admission, either the OPD or emergency. Then quickly go through the history of the presenting illness. These are the points you should ask and inquire about to rule out the risk factors and the differential. It includes onset, duration of jaundice, or any presenting complaint, associated factors which can be pruritus. If it is on the palm and soil, it is due to the of cholestasis, nausea, vomiting, fever with virus for malaria. Right hypochondrial pain to rule out viral hepatitis or cholecystitis or polylithiasis. Rule out hypertension by asking about any complaint of headache, blurring of vision, abdominal pain, dark urine and clay color stool for any jaundice, obstetric jaundice. And then comes the history of food, water, or any juice intake from outside to rule out viral hepatitis. If you ask about the symptoms of acute fatty liver of pregnancy, inquire about syncope, hypoglycemia, polyuria, polydipsia, or any of the coagulopathies. To rule out autoimmune disease, inquire about joint pain and rash. Ask the patient how much quality of the life has been affected with this presenting complaint. Inquire about the investigation done so far, the treatment taken, whether the patient has relieved from that treatment or not, and then the trimester-wise history. In the OPS history, inquire about the previous history of jaundice, hepatitis, or OPS coli in the previous pregnancy. In the past history, inquire about the history of polylithiasis, hepatitis B, C, or pancreatitis. Inquire about the drugs which the patient might have taken and causing the jaundice, which can include key medication, ciprofloxacin, Azomax, phenytoin, erythromycin, and augmentin. Then ask about the blood transfusion history and extraction to rule out the hemolytic anemia, any allergic history, any drug reaction history. In the family history, inquire if the pruritus, inquire about the scabies, inquire about the hepatitis and the family history of the OPS cholestasis. In the personal history, inquire the patient regarding his or her dietary habits. In the socioeconomic history, ask about the compromised status and the contaminated water intake history. So this is how you can complete your history. And then comes the differential diagnosis. These are the differential diagnosis for any patient coming with a jaundice or any other associated factors in the pregnancy. The pregnancy, including a specific differentials, are in the first trimester, it can be hyperemesis gravidarum. In the second or third trimester, it can be preeclampsia, ops cholestasis, or acute fatty liver of pregnancy. Others may include viral hepatitis A, B, C, D, or E, cholecystitis or cholelithiasis, acute pancreatitis, hemolytic disorders, and drug toxicity, which I have already mentioned, and history of chronic malaria that is associated with the fever with virus and chill, and any autoimmune disease. So this is how you will complete your history of jaundice in the pregnancy. For more details, subscribe our channel for the further updates and the rest of the history templates. Thank you and good luck.